Hello, good afternoon to everybody. My name is Elena, and I'm representing Vithoulkas Compass. And I'm very happy to be your host and facilitator for today's webinar with Andrew Ward on another one of his extremely interesting cases, a case of chronic ankylosing spondylitis. We apologize once again for the last minute postponement last Sunday, but Andrew had a slight accident, but as you can all see, he's well now, and so all is well. Therefore, a warm welcome to each and every one of you. It's lovely to see so many participants from so many corners of the world joining us. And as always, this session is being recorded so we can upload it afterwards onto our website and onto YouTube. And it is also an interactive session, so feel free to use the chat box for any questions you may have. We will have approximately 10 minutes for Q&As at the end of the session. And I now pass you on to Andrew Ward. Welcome, Andrew.
Thank you very much, Elena. And welcome everyone to this next in this series of working with what works in homeopathy, classical homeopathy with Vithoulkas Compass. And during this session, I'll be using, as I always do, Vithoulkas Compass and taking you through how this was used and showing the case, and then showing some more aspects of the program. And so I see some people still coming in here. So just to start off whilst they come in, this case was from 2000 when was it? It's a few years ago now, probably 2015, something like that, 2017. So, and this was a case of ankylosing spondylitis. Now, I'll just go through, for those of you who don't know exactly what that is. This condition, AS as it's known, ankylosing spondylitis, is a long-term chronic arthritic condition. It's seen as an autoimmune disease, as they call it. Chronic condition of inflammatory condition of the spine, usually the lower spine, but other areas, joints can be affected. This tends to develop often first in teenagers and young adults, and then progresses. It's about 3 times more common in men than women. So the symptoms generally can vary, but typically involve back pain and stiffness, severe stiffness in the lower spine, pain and swelling of other parts of the body, inflammation of the joints, inflammation of where the tendon inserts to the bone, and extreme tiredness. And this can all be tested for in blood tests, and it's part of one of the rheumatic diseases, as they call it. And I think the normal treatment is through anti-inflammatories, and then steroids sometimes, and then now new immunosuppressant drugs that are being used for these types of conditions. So let me share my screen. Okay. So here we have the case here. You can follow. 2017 first appointment, arthritis, actually in her case, 46-year-old woman of the L5 lumbar vertebra with signs of, in the scans, degenerative process arthritic condition. So she'd previously been trying diet and herbalism with no effect. Much worse in the last few months. Presenting typically with lower back pain, lumbar, much worse at night, and much better for movement. So it makes sleeping very difficult for her. Waking up every night after some time, feels uncomfortable, has to move, has to get up, then goes back to sleep, then wakes up stiff. And this cycle that we see commonly with rheumatic diseases. The history, in 2000, she'd contracted chlamydia, was given antibiotics, and developed a reactive arthritis, for which she was given non-steroidal anti-inflammatories, which dealt with it. We would say perhaps suppressed the inflammation. In 2007, she got her first bout of AS. In 2009, she had a road traffic accident with multiple fractures and 3 operations, and then developed, which is part of the rheumatic inflammatory chronic condition, she developed rheumatic uveitis, so inflammation of the uvea, for which she was given cortisone. In 2014, the uveitis recurred and the back pains became worse, and she was given cortisone. 2015, uveitis recurs again, worse on the left side, and then she came to see me in November 2017. So that's the story. Obviously, she developed this reactive arthritis, which suggests she has a predisposition for arthritic conditions. What Hahnemann would have called a maintaining cause. So some kind of underlying predisposition, and then some kind of, as he calls it, exciting cause or trigger, which in this case was the antibiotics. And then after this, after these suppressions, the inflammation came more and more, went to the eyes, and the back became worse. Mentally, she said, tends to suppress her emotions, very rational, organized, analytical, likes to know where she stands in life, likes to be on her own, more relaxed. Very general things, nothing very significant. Big, strong fear of heights and illness, anxiety about her health, and a tendency to gain weight very easily. 2013, she had also 2 uterine myomas. That's a spelling mistake there. Myomas diagnosed. So uterine fibroids. General foods, a love of sweets and cakes and bread and eggs, liking of eggs, an aversion to meat. In terms of her level of health, her last fever with an acute was 2 years ago. So this puts her in an upper group, probably level 3, somewhere like that. For those of you who know the levels of health, a very recent acute with fever. And so what does this tell us? This tells us that the condition is curable. The remedy should be clear. So the prognosis is good. It's not such a long time she's had it, and that inflammatory process should be able to be reversed. So the first repertorization I did, we see here on the left. So we see here fear of high places, which was strong. The inflammation of the eye. So you see here you have exactly what we're looking at: arthritic inflammation, gouty or rheumatic inflammations of the eye. So you see quite a few remedies there, which is exactly what's happened to her, which you see in several chronic rheumatic conditions. Recurrent inflammation of the eye, fibroid tumors, presenting symptom, which is the lumbar pain, better for movement and motion, and her desire for eggs, quite strong, aversion to meat, desire for sweets. So I'm sure many of you will know that this looks like a case, as you see, of calcarea carbonica. And we'll see the results here. Where are those? Oh, all remedies hidden by filter. No, what does that mean?
Try clicking the filter, Andrew, and see if it is written anything there. No. Type A and then delete it.
A. Huh.
Okay, try go back then to yes close analysis and try getting in again.
Maybe we can just go to the prescription.
Mm-hmm.
Let's try analysis first. Very strange. There's no filter. Okay. Let's go to the prescription. Will that show anything? Yeah. Okay. So this is the result of that repertorization, and we see here that we can go through all these things, but in the general, we see calcarea has now the symptoms have reduced. Why is that? Well, yes, I'm sorry about this. I'm not sure why this is.
Click, change something on your repertorization, and then try to solve it again, and then put it back.
Add a symptom or delete a symptom?
You can change the degree.
Degree, okay. Let's change this one. Continue editing.
Yes.
Okay, yeah.
Very good. Yeah. Slight glitches, but anyway. So here we are. Calcarea showing clear
You can
remedy.
change it back to 3 if you want to. Otherwise, you can leave it as it is.
It's okay to leave it like that. And we can see here why calcarea has actually all 9 symptoms. Very clear, huh? No doubt. Everything from the eye inflammation, the generals, to the back pain in first degree. And we also have some metadata, which is some extra information that Compass gives us to differentiate between certain remedies. So here between calc and phosphorus, for instance, which comes up, and then nitric acid and calc with their anxiety. So some extra help in differential. So she was given calcarea. I go back to the symptoms. C. I think I gave her 2 or 3 doses to take over a couple of days to see her response. And there was no effect at all. So this was a bit mysterious to me. It seemed very clear, but she'd had also a repeated dose with no effect. And it reiterated to me that the back pain was much worse at night, much better for motion, much worse for first motion, and better for warm bathing. So here we go to another analysis. No, not that one. What's happened here? Okay. Anyway, I put some symptoms in. There should have been some more. I don't know quite what's happened to them. We can even have a look now. For instance, back pain once at night. We want to see the symptom is in here. We can put it in, or we can have. We've got the better on movement that she said. First movement, motion ameliorates, so we can say back pain. I think it will be under, is it beginning or beginning to move? Yeah, and better on movement. So we can say put that in. Even we have lumbar pain here, commencing to move. So, and warmth. So we had also back pain, warm. Do we have warm bathing? No. We can just then use the general symptom. Warm bathing ameliorates, which was another of her symptoms. Bathing ameliorates in here. Okay. So this is the honed down information. And we see with these symptoms, it's typical presentation of Rhus tox. I'm muted. All 6 symptoms here for Rhus tox. And we can even, if we want to see some materia medica and compass, we can go straight to here. So we see that typically they're aggravated by rest and become very stiff if they rest, and then they have to move. So you see here, beginning of movement is worse. better movement and warmth. Restless is in bed because of the pain. You see, they have to keep changing, is what she had. So we could have put this symptom in, change of position, etc. So the next prescription on the 22nd of January 2018 was Rhus 30C daily until an aggravation, then stopped. And she reported an improvement in the back in the first evening, then developed an acute sore throat with a cough. So she then stopped the remedy until that went away. And then we spoke on the 9th of February, and I said continue the remedy if needed. So she was taking it for a bit longer. When she felt the pain, she would take some. And then on the 9th of April, she reported that the back has been very good in February and March, can still wake sometimes with pain in the night at around 4 a.m. I said continue to take it if you need it. So then we go on to November. So so we're looking at 6 months. And since May, no problem with the back, no pain at all. So, and she's not been taking it every day. It's just for the while that it helped. And then once the pain went, she stopped. And the MRI in the April, she went to have another MRI, and it showed no sign of the degenerative process of the spine or arthritis. And remember, at the beginning, she had degenerative signs of the vertebra and arthritis, and was diagnosed with this. Now, no sign. Very interesting. However, this isn't the end of the story, which is why I wanted to present this case, because after this, she started to develop a very serious and bad-looking eruption on her face. So we see here the law of cure, the direction of cure, with the inflammation coming from the joints out onto the surface, onto the skin, which is a very good sign. We know that's a classic sign that the remedy is acting curatively. She's free of pain. Now there seems to be no disease in her spine, but she's got this very red, itchy, burning rash with swelling around the eyes. It was all around, circumscribed around the eyes, and terribly itchy. And she was very upset about this, of course. And this is where education comes in, where we need to educate our patients about the direction of cure. If we don't, then they get angry with us for making them look horrendous, she said. I can't go out because of the way I look. But of course we can say, but what about your back? But see, people are not used to linking these things, and she didn't understand that those two things were linked. Because in medicine, we're sent to different specialists, aren't we? Back, special orthopedic, and dermatologists. Nothing to do with each other. Whereas we know something will come out on the skin and it's actually the same condition. It's just shifted level. So if they don't know this, then it's more difficult. So we need to educate patients when we treat them that this may happen. She also developed a bit of a cough, which was an old symptom, cough with breathlessness going up the stairs. Now that is a keynote of calcarea. So, and we know that calcarea and Rhus tox are complementary. So it seems that I'd given her what you might call possibly her constitutional remedy. We don't exactly know. First, without any result. whereas in fact she needed the acute remedy, if you like, although it's acting deeper than that. First was Rhus. So this is an interesting case to where we can get confused by looking at all the general symptoms and saying, well, this is a calcarea case, when she needed Rhus for her presenting condition. So now we're on to January 19, and the eruption. I said to her, wait, of course, we have to say to them, wait. The eruption on her face and eyelids and around the mouth, it's all spread now, is worse. She's getting hot with flushes of heat, swelling of the skin. She says it's spreading. Some small little white pustules, worse for heat, better for cold. And at this point, she was pushing me, really pushing me for a remedy. And up to this point, I'd resisted and said, no, you have to wait. But then, she started to kind of use a bit of blackmail. She said, well, if you don't go in, I'll go to the doctor and get something to get rid of it. It's like, oh, okay, we know that what that might mean, the suppression, the back inflammation, rheumatic will come back. So I gave in, which was a mistake, but I think she would have gone and got it suppressed. So I repertorized. I don't know, let's see if this is going to work. We have to change it again. Yeah. So here we see, of course, Rhus still the remedy. We know that it's a curative action. However, we see with her skin thing, apis coming up for the swelling and the heat and the better cold, and also some eye inflammation, of course, which she had. So I relented and gave her apis. Here we see apis. 30C. And she rang me in great relief and she said after the second dose, the skin was much better for the next 3 weeks. But I was not happy with this, thinking, okay, I didn't really want to prescribe, but okay, she needed something. And after 3 weeks, all the back pain at night came back. So I'd successfully suppressed her curative response of the skin by using apis locally, as it were, local prescription, not just the skin. And the back pain, the inflammation came back again. Some inflammation of the eye again, also pain in the left hip. So this was very disheartening. And then at this point, she finally understood the link between the two things. Because I've been trying to explain it to her and she didn't believe me. And finally I said, do you understand it now? You see what's happened? We've suppressed the skin, back pains come back. And so she understood. So she agreed to take the Rhus again, 30C. By March, the back was better again, no pain. And the eyes had also, the inflammation in the eyes had gone. So no inflammation. And the skin erupted again on the face with some pustules. This time she was understanding not to touch it. And then we had contact again in the June of 19. I've got some emails I can read here. And but basically she said that the The back and eyes were fine. The latest scans showed no damage to the vertebra and no inflammatory process, neither in the eyes. The skin is red now and has been diagnosed. You see how medicine is. They say, oh, you've got rosacea now, another autoimmune disease. And they want to give her some antibiotics for it, and she refused. This was diagnosed by a skin specialist, you see. Because now the back's better. No need to go to the orthopedic. Or rheumatologist, rather. And in the note, she said the consultant said she must have had a light form of ankylosing spondylitis because it's gone. That was her comment. A light form. Wasn't diagnosed as a light form. So just to say here, yes, this was in the April, the skin had come back on the cheeks. At the back was better. She said, thank you for your email. I'll be away for a few weeks, but you can use my case in your teaching presentations. There is still a little inflammation on the face, just redness, which the orthodox medicine has identified as rosacea, which is the reason why I'm still waiting to see how it all proceeds. The scans are available, but they need specific software. I can't see them, but the response in the report was that there was no damage arthritis related, just a little wear and tear in the back. And the orthopedic surgeons said they thought it was a light version of the illness. No uveitis or trouble sleeping. And this was a very good response. And she, after that, I didn't hear from her after that. So I'm presuming, unfortunately, I didn't hear from her, but it's a couple of years, this case. So I'm presuming that things went well and she just ended up with a little bit of rosacea on the face and her rheumatic condition was a thing of the past. But she understood and she learnt from this case, as well as I did, not to be bullied into prescribing when we shouldn't do. And we can have a little look at Rhus tox. I'm sure you're all familiar with it, but we always think of Rhus tox as an acute remedy. This case shows that it has deeper action than we sometimes think if it's well indicated. So, and there's no reason why it shouldn't be useful in chronic conditions. I never had the chance to find out if she needed the calcarea next. It's my guess is that probably that's what would have come next in her case, is calcarea, because of various things she said, if you remember, in the beginning, which was that she had some myomas, uterine myomas, and she had a strong fear of heights, and she liked sweets and eggs and gained weight easily. These are keynotes of calcarea. So it was just given at the wrong time. You see, it's to do with timing. So we see sometimes several remedies indicated, and you have to give the correct one first. And this is something that I've learned over the years is of great priority, is that you need to give the correct first remedy, not the one you think it is. You have to give the right one that's indicated. So we, of course, can think, oh, I think it's gout. No effect. even though she had some symptoms. It's the next remedy, you see. And on top of it is the Rhus state. And then that gets taken away, and then the calcarea will be more obvious. Unfortunately, I lost touch with her, so as people do when they're better, they stop coming to see you, of course. So that's the idea, that it's some layers, and the calcarea would have been probably her constitutional. If you remember, she said about herself, she's a very rational person, very organized, likes to know where she stands in life, doesn't like a lot of demands on her. This is all very calcarea type statements. You know, they like a simple life, they like their home life, and they like everything to be clear and rational and explained. So I think this is, and she had an aversion to meat, which is the calcarea thing. So I think it's what she would have needed next. But sometimes it's hard to keep people on board once they're better. So Rhus, we see restlessness is the key idea of Rhus. Now, why are they restless? They're restless because they're in pain. And it's the type of restlessness where they have to move because they feel better. So if they rest, they start to feel worse. They start to stiffen up. It's all typical of rheumatic arthritic conditions. Stiffen up, and then they think, I've got to move. It's painful now. And they start moving. It's like, oh, painful, painful joints, back, ouch. And then as they move and start moving and limbering up, everything gets relieved for a while. Then they move around, and then they start to get fatigued, a bit painful, and they sit down, they lie down, and the whole cycle starts again. Stiffness, pain, they've got to get up. And so you get this up, down, up, down. So this is their restlessness. And this can also be in their mind. They can be restless in their minds. Also, it's a generalized essence of the remedy. And if it starts to affect the mind, which is rare in Rhus, usually Rhus you'll see physical pathology in the joints, but if it gets pushed deeper, and those things disappear, you'll start to see mental disorders where you've got obsessive compulsive disorders, OCD. And it's one of our remedies we think of for this: compulsive, ritualistic, superstitious behavior. In the repertory, you'll see it under superstitious fear. Rhus. Only remedy listed, actually. So what's the difference? Well, superstitious fear is the type of thinking where you think if you don't do something in the right way or the right order or the right number of times, something bad's going to happen. Yes, so it's a fearful type of superstition. And we see other remedies here, but you see Rhus, one of the high degree remedies in this, along with Manzanilla, Lycopus, and Conium, and Argentum nitricum. So, and to a lesser degree, they can have a generalized anxiety about their children and about their business. And on a deeper level, they can become paranoid. It goes even further, paranoid that they're going to be poisoned. So there's, in all remedies, as you know, there are stages of pathology and symptoms. So we have early stage pathology of Rhus will be the skin, because they also get very strong skin eruptions, all sorts of skin eruptions, hepatic eruptions, It's very useful in herpes and in shingles. And the key symptom that it shares with Rhus venenata is that the eruptions and the pain and burning is much better for warm or hot bathing. So we'll see here Rhus venenata, which is poison elder. And I've used this myself for shingles, which worked within 48 hours. The whole thing was over, just because I noticed that the shingles was better if I put a hot shower on it, hot water. It was relieved. So, Rhus venenata. Okay, 48 hours, the shingles was over with no complications. You see here, itching relieved by hot water. So this is part of the group of plants like poison oak in America, poison ivy, Rhus tox, poison elder. They're all skin reactions from these poisonous plants. So they have very strong. So on a small, lesser level, they'll have skin eruptions. Then on slightly deeper level, they'll have joint pains and rheumatic problems, arthritic. And then on a deeper level, they'll go into obsessive compulsive disorders and paranoia. You see, so it depends where you see a patient at what stage. This stages is the word. So you may see a stage 3, or you may mostly see stage 2, which is the joint problems usually. Unfortunately, in this case, when she had her skin eruptions after the success of the remedy, it would have been very nice if her skin eruptions also had Rhus tox modalities, so that they were better for heat. Then she would have just needed some more Rhus tox and it would have cleared things away. Unfortunately, it wasn't. It was the opposite. She wanted cold, and which is why I got distracted into giving apis mistakenly. So that's the main, what we'll see really in Rhus tox, the better movement, worse first movement. Cold, damp, of course, this is typical of rheumatism. They're affected much worse by the cold, damp weather. Red tip of the tongue, sometimes a very good confirmatory symptom. Yeah. So, yeah, there we are. I think I can leave it there, really. We'll have some questions now in our 10 minutes or so.
So, Andrew, you want me to give you the questions?
Yes, thank you.
Okay, excellent. So basically we have one question beginning with Anna Krudnovsky, and she asks you if you thought of giving placebo instead of apis.
Yes, that's a very good idea, isn't it? I probably didn't think of it at the time. Obviously, I didn't think of it. That would have been an excellent idea because it would have kept her happy, and she would have thought she was taking something. So,
Yeah.
yes, and it was a mistake to give another remedy. It's true. Very, very good point.
Okay, so Natalia Voronina asks if we could show the MRI, which we can't, or explain what was the primary damage of L5.
Yeah, I never got to see because she said that these things were on some electronic version that she didn't have the software for, so I never got to see them. I can only say what they reported, which was this degenerative signs of L5 arthritis, and then they diagnosed it as AS through the blood tests. So that's all I can say, really. I don't know if there are some rheumatologists here or you can say more.
Okay, so I'll pass on to the question of Tony Pincus, who asks, if you follow up with a miasmatic analysis, because he says it seems like a tuberculonic case with a chronic inherited trait, and give tube BOF to support the Rhus tox, as well as the constitutional remedy. Does the program allow a miasmatic analysis? Also, why didn't you revert to the deep-acting mineral antipsoric calcarea carbonica after the acute flare-up was abated by Rhus tox?
Well, I didn't go back to the calcarea because the skin eruption came out, which was very severe. So it was a question of trying to deal with this, because there was no possibility of waiting for her. She was desperate. Now, would giving calcarea at that point have solved her skin issue? It's a possibility. We don't know. But she had very clear local symptoms for that skin condition, but it was incorrect to do so. So yes, maybe it would have been the time to give calcarea then. It's correct, possibly, yes. The tuberculin wasn't indicated, but does the program allow miasmatic analysis? Yes, I mean, specific analysis. I mean, obviously, miasmatic, I guess you're meaning I probably need to know more about what you mean by a miasmatic analysis, actually.
Okay, so let's pass on to Suzanne Field. And she asks, what was her level of health in group A3?
Yes, I believe so.
Okay. So now we pass on to Peggy Bide. Welcome, Peggy. I'm glad you were able to join, because she was very interested in joining this this webinar with you, Andrew. And she asks whether blood tests were done in the beginning to confirm the AS gene. Did the patient have a history of skin ailments prior to seeing you for AS? Did you use thermals to differentiate remedies during your repertorization?
Thermals?
Yeah.
I presume you mean cold and warm.
Peggy?
Yes, sorry, yes. Was she cold-blooded? Did she respond
Yeah,
worse to cold, wet weather?
Yeah, she was chilly. So another point towards calcarea, really, which I believe was her underlying remedy. So, you know, again, a mistake with the apis because they're very hot, and it's just like a suppression with homeopathy rather than steroids.
Oh, I see.
So it's a good lesson. We can do that ourselves, and it's wrong. And luckily, we reversed it again, and then the skin eruption was bad, and then she learned to live with it more. But unfortunately, as I said, if she'd continued, going back to Tony's point, we would have seen calcarea next and given it, and she would have been even better. But
Okay.
yeah.
Thank you, Andrew, for that.
Blood tests were done, yes.
So this is Joanna, and this is, she's got a question asking you, how about calcarea instead of apis?
Yes, well, that's a similar point we just made.
Yeah.
It could have been useful then, it's true. But calcarea doesn't really have those modalities, you see, of the skin. But as we know, treating skin things locally is not a good idea. We should be treating the patient. So,
yeah.
anything, calcarea would have been a better prescription.
Okay, so now Varangana asks, why not use mind symptoms to repertorize?
Well, I didn't use them because she didn't really have any what I would consider real mental symptoms. So it's very important. I've just been teaching this on my course, that if we're going to use mind symptoms, they need to be pathological. So a mind symptom needs to be a pathology, like any symptom, for it to be used. Not just using things that relate to the person's personality or character. So she said things like, I'm very rational, I love animals. These aren't symptoms. This is just her.
Mm-hmm.
So actually the only mind symptom she had, which we put in, if you remember the original repertorization, was fear of heights. So which brought calcarea up, of course. So we did use a couple of symptoms, but she doesn't, which is quite typical in these strong physical pathologies. They don't have many symptoms. It's very one-sided. It's all very focused on the physical body. So their mental level is usually very, very healthy.
Okay, thank you, Andrew, for that. And now we've got a last question, which is from Ines Caras. And she asks, could changing the potency make the aggravation go away faster?
Of the skin we're talking about here. Changing the potency. Well, yeah. You mean probably by giving a higher potency of Rhus tox?
Yeah, she means, I mean, the aggravation of the skin, yes.
I don't think so. I think if you were to give a 200 of Rhus tox, it would just make the skin worse.
Mm.
So I think we've got to be very careful, because you see the inflammatory condition and of the joints and the skin are the same thing. It's only medicine that gives them different names. It's inflammation. So the inflammation on the skin is going to be commensurate, equal to the inflammation on the joints, which is quite severe. And that means the skin, when it comes out, is going to be quite severe. It has to be equal. You see?
Mm-hmm.
So we've got to be careful, because that kind of aggravation can be really unbearable. And she was forcing me to do something. She would have gone and got steroids.
Yeah. Okay. Thank you, Andrew. Now, another thing, I have one more. Do we have? Yeah. So basically, we have finished with the questions and answers. That was all for today. And of course, obviously, in the chat box, we have lots of participants expressing their thanks, that it was an extremely interesting case, and that they're all looking forward to seeing you next time, which will now be in September.
Yes, I look forward to it. Thank you very much for hosting this webinar. And I encourage everybody to, if you haven't already, to sign up to a free trial with Vithoulkas Compass. Magnificent tool for our use of classical homeopathy.
Perfect. Very good. So I don't think we have anything else. Do we have anything else?
That's it.
Okay, so we close this webinar. We thank everybody very much once again. It was lovely seeing everybody from so many places around the world. It really was. And we'll see you again in September, and maybe in July. Hopefully you all will join Andrew's course on the 20th and 21st of July, which I believe you will all find extremely interesting. Thank you all. Bye-bye.
Very much.
Bye.